Blog Talk Radio.
BlogTalk, RealTalk with the Cummings. My name is Mark Angelo Cummings.
And I'm Lena Cummings, and we're coming to you from Silver City in our little neck of the woods here in New Mexico.
Very lovely little place, New Mexico, where everything's green and a lot of mountains and great stuff.
And pears.
And pears, yes. We went out for a walk today and we ran into a pear tree, and those that joke that, I forgot it now. Yeah, and if I was kind of like paranoid, they'd go up and grab it. Yeah, we won't stick to the joke. But anyway, guys, thank you so much for joining us yet again. We get excited every time, Monday, Wednesday, and Friday, bringing you the latest news that we find. And it might not always be the news that you want to hear, but, you know, it's important to tell the truth, to find information, to have discussions, to give people options, not just a one-way street as it has been for the past few years.
It's just nice to be able to present a different option for people to, you know, latch on to. I mean, there's so many one-way streets out there. It's nice to have a different option to go down.
Yes, definitely. And I was trying to see if I could open up the chat, but this ain't going to work here. In case you do have anybody that wants to ask questions on the chat room, but I did this wrong now, so I won't be able to do it. But you could always call in at our number to call in is 267. That's the area code, 521-0152. Again, that's 267-521-0152. And we'll accept your questions, comments. You know, just try to be nice. Remember, we're on the air. But anyway, tonight we're actually going to be talking about the drugs that kill in the transition world. And, you know, there's been many accounts on individuals that are not trans that have been prescribed Lupron, and it has not turned out very well for them. This is a drug that has not been approved by the FDA for the use that is being used for children to block their puberty. And, you know, this drug is given to kids in the quest to save their lives, when in the end it could actually end up taking their lives.
And it's really a drug used initially to treat prostate cancer. So,
yeah,
and endometriosis. So this is not something that the FDA even recommends, but apparently doctors in the gender transition world at these gender clinics have used it as their main drug of choice.
Yeah, it's pretty sad because, you know, the side effects are long and wide. And, you know, it's alarming just to hear adults taking these drugs that even after stopping the use of this medication continue to have lots and lots of issues, which, you know, we're going to talk about these issues now. And, again, you're very much welcome to call in or join the chat. You know, I right now just saying thank you for joining, and it's open. If you click on the link that we provide on our Facebook, you'll be able to automatically listen to the show and also chat at the same time. So anyway, we're going to start with an article that is very alarming to me, because you have this young woman who has suffered from, you know, all sorts of reproductive problems, endometriosis. I mean, nowadays women are faced with all sorts of problems in their ovaries, uterus, and I safely would say it's chemicals in our environment. So they go to the doctor to get some help, and they prescribe this Lupron. So the article reads, I'm now 30 years old and a mother of 3 very beautiful children. I'd suffered for years with irregular menstrual bleeding, horrible lower pelvic pain, cysts, polyps, and heavy bleeding, which I used to when I was identifying or presenting as a female. You've heard of Niagara Falls, right? And so I spent a lot of time in and out of doctors' offices, emergency room, and all for nothing. The doctors would look at me like I was crazy, and that's what doctors usually do with women. I know that their assumption was probably something along the lines of, she's just coming in here for pain medication, when in fact I never took pain medication. It made me feel ill. Finally, I came to live in a small town where the numbers of doctors were limited. The doctors here think they're God's gift to earth. They aren't.
From the pill to Lupron, is this the best we can do? Step 1. I meet with this sweet doctor. She does her exam. She recommends a low hormone birth control pill to help get my cycles back on track. Standard procedure. I can accept that. After weeks of trying, my bleeding was not improving, and neither was my pain.
Step 2, I go back to sweet doctor to look at other options. Get offered the IUD and I decline. Get offered another form of birth control, I decline. End up with another birth control pill.
Step 3, call the doctor's office freaking out because I just passed what I thought to be a miscarriage. And how can this be possible? My tubes are tied. Per the doc's request, I took the thing to the laboratory for pathology.
Step 4, doctor calls the next day. It's not a baby. It's an endometrium tissue. Come in to talk about options. And so we talk, and she decides that our next option is to go into surgery. She wants to go in through my vagina, remove polyps, tissues, whatever nasty things are up there. And then she wants me to do a DNC to really make sure it's all good and clean. So we do.
Step 5, nothing has really changed after that surgery. I go back to the ER in excruciating pain. They run a few tests, then call my OBGYN. The doctor comes back into the room and says, quote, I talked to your doctor, and she says that there is no reason you should still be having pain down there, and that you need to go see the general surgeon, unquote. Meanwhile, I am crying hysterically. Are they right? Is this all in my head? Am I crazy?
Step 6, I go to see the general surgeon. The doctor sends me to have some liver, kidney, gallbladder tests. Clear. He schedules me for a colonoscopy. Clear. He says he can't help me.
Step 7, I go back to my OBGYN. Tell her I am still in a lot of pain. I have not stopped bleeding for over a month, and I need something else. I've already had my children. My tubes were tied. I just wanted the pain to go away. And so I asked my doctor for a hysterectomy. She said she wasn't ready to go that far yet and that she had another option. And enters Lupron.
And this is really crazy because here's this woman with pain and whatever else, and she can't get her hysterectomy. Yet FTMs go into a doctor's office and say, hey, I'm a man. Remove my inside. No problem. Removed. Lupron, Lupron, Lupron. Oh, how I loathe thee. Here I am, this 29-year-old woman with 3 kids and an ability to be their mother because I'm always in pain. I'm tired and feel awful from constantly bleeding. When someone you trust offers you a sort of quick fix to all your woes, hell yeah, 2 shots in 6 months and my life is going to be so much better. Boy, oh boy, was I wrong. I get my first dose of golden nectar and I'm ecstatic. That is, until the symptoms started to kick in.
My mood changed drastically. I suddenly couldn't control my emotions. I couldn't control my temper. I couldn't control anything. I was living at my mother-in-law's house with my husband and kids. Tensions were high, spaces were tight, and God love her and I could have killed each other, I think. No worries, we get along great now. And then came the depression. I have battled it my entire life, but this was different. This was a whole new level of low. My husband and I were fighting constantly, and rightfully so. I was not an easy person to get along with. We weren't speaking and barely existed at this point.
Suicide attempt, July 4, 2016. I came home with my children and put them in bed. I stood in my kitchen thinking about my life. I started to cry harder than I ever had before, and I lost it. I lost my mind. I opened my medicine cabinet, and I swallowed a bottle of pills. I sat on my floor and sobbed for what was only a few minutes, but seemed like an eternity. A thought of my children coming out of their room and finding their mother dead on the floor. I ran to the kitchen sink, stuck my finger down my throat, and threw them all up. I asked myself, what the hell is wrong with you? Then I realized that this depression and suicide attempt were possible side effects of this drug. Other women who have taken this drug have experienced the same thing. I see my doctor again to get my second dose, and I don't mention that I try to harm myself, only that I have thoughts of harming myself and that I'm very depressed. I am now having hot flashes or the gates of hell flashes, night sweats, fatigue, and headaches. Those are just side effects. They will go away in the end, she says. I got a medicine to give my body a bit of hormones and to try to help balance me out. Meanwhile, I'm still bleeding fairly heavily and in some pain.
When Lupron was, quote-unquote, over, isn't that hilarious? When Lupron was over, it will never, ever be over. It has been 7 to 8 months since my last shot. I still suffer with short-term memory loss. I have the hardest time remembering the smallest things. Conversations, what I'm getting at the grocery store, who I told what. It's awful. My bones hurt so badly. I have a hard time running after my children because of this awful pain in my legs. My hands throb, my shoulders ache, and even my toes hurt. I can't control my pee anymore. I actually peed myself at work. I know, embarrassing, right? I have a migraine every other day, and I have gained a ton of weight. I'm always thirsty. I can never get enough water, and my vision is getting worse. I hope and pray that all of this is temporary and that one day, soon, I will get my sense of normalcy back. But the truth is, every other woman that I've talked with about Lupron and the side effects that they have had has experienced the same thing. I will deal with this for the rest of my life. It sucks. I am trying to stay positive. My husband and I, we're doing great. My kids are healthy and happy, and I will not let this beat me. God bless, and I hope this helps someone.
So, okay, let's talk about this a little bit. They are giving this same medication to very young, vulnerable children in the quest to save their life, in the quest to stop their puberty, just in case, if they change their mind. There is no side effects according to the medical professionals. So here we hear this account. What do you mean? What do you think about this?
I mean, it's obvious that this drug is not helping any and causing more neurological issues than it's solving. So,
suicidal tendency, depression, anxiety. What does that sound like to you? Who have we seen who's in the media that is experiencing all these things and they had something similar implanted in their arm, and to me, they've gone from worse to worse. They're overweight,
Yeah, it's really, really disgusting. But, back in 2005, there was a study of men who take Lupron for prostate cancer, and they found that it significantly increased the risk of fractures with prolonged use, raising the risk. Yet the impact on the bones of children is still up for debate.
Yeah, and children that are still growing, their epithelial plates haven't closed, their neurological system hasn't fully developed. I mean, they're stopping, like the second characteristics, but don't they realize that they're also stopping other things? And plus, giving drugs, as we see Jazz gained weight, went through bouts of suicide, depression, anxiety, has these weird eye movements that we're seeing, every time we see her talk in any events or whatever. So we're claiming to save kids' lives, but in actuality, we are shortening their lives and we are creating bigger problems. I mean, these kids could end up all of a sudden say, hey, I don't feel like I'm in the wrong body anymore, but now I have a lot of heck of issues to deal with.
So this doctor, a researcher actually, her name is Chandler Mars. She's an endocrine specialist who studies women's health. And she said she was surprised by the severity and duration of Lupron's side effects. So she posted a survey aimed at getting more information. With little funding to do outreach, and more than 1,000 surveys came back. And the women reported a wide range of symptoms. 30% cited severe joint pain, 29% severe body aches, 26% cracking teeth, 20% osteoporosis. More than half reported moderate to life-threatening depression. More than half.
That's crazy.
15% of the women rated their suicidal thoughts as life-threatening to severe. And this is why. Mars believes a uniting factor explains the diverse and severe range of symptoms. Lupron cuts off a woman's estrogen, eliminating a key hormone called estradiol that regulates the energy centers of the cell, the mitochondria. She said the misconnection between the hormone and the cellular powerhouse will hurt each woman where her body is the most vulnerable.
Yeah, it's crazy. And, you know, you guys, if you have a story of someone you know and your child has been on these blockers and you want to share your story and you want to come out and you want to help people see the truth of the matter, please contact us on transitionradioshow@gmail.com. We would love to interview you. We'd love to hear from you. Or you can call us now if you're listening at 267-521-0152. Now, I found this article. It's a fairly new article in June of 2017 from the Daily Signal. New paper says puberty blockers aren't the answer to gender confusion. Increasingly, gender therapists and physicians argue that children as young as 9 should be given puberty blocker drugs if they experience gender dysphoria. But a new article by 3 medical experts reveals that there is little scientific evidence to support such a radical procedure.
The article, titled Growing Pains, Problems with Puberty Suppression in Treating Gender Dysphoria, published Tuesday in the New Atlantic, discusses over 50 peer-reviewed studies on gender dysphoria in children.
It is co-authored by Dr. Paul Rars, a professor of Washington University School of Medicine, and Dr. Lawrence Mayer, a scholar in residence at Johns Hopkins University School of Medicine and a professor of Arizona State University, and also Dr. McHugh, University Distinguished Service Professor of Psychiatry at the Johns Hopkins University School of Medicine. Last year, let me see here because this opens up, and okay. Last year, Mayer and McHugh published an extreme report on sexuality and gender in general. Now working with Ross, an expert of pediatrics, they focus on children.
As I explained in my forthcoming book, When Harry Became Sally, was founded to the transgender movement, the best biology, psychology, and philosophy all support an understanding of sex as a bodily reality and of gender as a social manifestation of bodily sex.
Biology isn't bigotry, and we need a sober and honest assessment of the human cost of getting human nature wrong. This is especially true with children.
And yet, pediatric gender clinics and therapeutic interventions on children are on the rise. In the past 10 years, dozens of pediatric gender clinics have sprung up throughout the United States.
In 2007, Boston Children's Hospital became the first major program in the United States to focus on transgender children and adolescents, as its own website brags.
7 years later, 33 gender clinics had opened their doors to our nation's children, telling parents that puberty blockers and cross-sex hormones may be the only way to prevent teen suicides.
Never mind that according to the best studies, the ones that even transgender activists themselves cite, 80 to 95% of children with gender dysphoria will come to identify with and embrace their bodily sex.
And never mind that 41% of people who identify as transgender will attempt suicide at some point in their lives, compared to the 4.6% of the general population.
Never mind that people who have had transition surgery are 19 times more likely than average to die by suicide. These statistics should stop us in our tracks. Clearly, we must work to find ways to effectively prevent these suicides and address the underlying causes. We certainly shouldn't be encouraging children to transition.
The sad reality is that while the number of pediatric gender clinics is growing, very little is known about gender identity in children, and many therapies amount to little more than experimentation on minors.
Professional standards of care being promulgated that state children should receive puberty-blocking drugs at a young age, as young as 9 years old, and cross-sex hormones at the age of 16. but there have been no controlled clinical trials of puberty blocking for gender dysphoria, and the Food and Drug Administration has not approved these drugs for treatment of gender dysphoria.
Meanwhile, despite claims by advocates, there is no evidence that puberty blocking is reversible, nor that it is harmless. Most concerning of all is that these treatments run the risk that children may persist in their gender dysphoria.
Blocking puberty could cause children to persist in gender dysphoria. In this new article, Horstmeyer and McHugh explain that transgender-affirming treatments of children may drive some children to persist in identifying as transgender when they might otherwise have, as they grow older, found their gender to be aligned with their sex.
As the doctors note, quote, gender identity for children is elastic. That is, it can change over time. And plastic. That is, it can be shaped by forces like parental approval and social conditions.
As a result, if the increasing use of gender-affirming care dose causes children to persist with their identification as the opposite sex, then many children who would otherwise not need ongoing medical treatment will be exposed to hormonal and surgical interventions.
Whereas 80 to 95% of children with gender dysphoria will come to identify with and embrace their biological sex. None of the children placed on puberty blockers in the Dutch clinic that pioneered this treatment came to identify with their biological sex. All of them persisted in their transgender identity.
Indeed, as Rosemeyer and McHugh explains, if children placed on puberty blockers rather than assuming biological normal puberty, these adolescents generally go from suppressed puberty to medically conditioned cross-sex puberty when they are administered cross-sex hormones at approximately the age of 16.
The doctors worry that transgender-affirming treatment, puberty blockers, and cross-sex hormones may have solidified the feelings of cross-gender identification in these patients, leading them to commit more strongly to sex reassignment than they might have if they had received a different diagnosis or a different course of treatment.
The Dutch doctors who pioneered puberty blocking as a treatment for gender dysphoria argue that it would give a child more time to explore their gender identity without the distress of developing secondary characteristics.
And this is an odd argument, as Bruce Meyer and McHugh explain. It presumes that natural sex characteristics interfere with the exploration of gender identity when one would expect that the development of natural sex characteristics might contribute to the natural consolidation of one's gender identity.
The rush of one's natural sex hormone and the bodily development that takes place during puberty may be the very thing that helps developing boy or girl come to appreciate and identify with their bodily sex. And yet puberty blockers would prevent this from taking place.
Rosemeyer and McHugh highlight the possibility that the interference with normal pubertal development will influence the gender identity of the child by reducing the prospects for developing a gender identity corresponding to his or her biological sex.
For more of this, see Ryan T. Anderson's forthcoming book, When Harry Became Sally, responding to the transgender movement. So the treatments proposed by transgender activists, social transition followed by puberty suppression, cross-sex hormones, and possibly surgery, make it more likely that children will engage in self-reinforcing activities that make persistence less likely. Anything that would encourage a child to persist in identifying as a transgender should give us pause.
As Ruth explained to a federal court, desistance, i.e. reversion to gender identity concordant with sex, provides the greatest lifelong benefit and is the outcome in the majority of patients and should be maintained as a desired goal. Any intervention that interferes with the likelihood of resolution is unwarranted and potentially harmful.
Puberty blocking is experimental. Not only does a trans-affirming therapeutic approach run the risk of prolonging transgender identity in children who otherwise would have grown out of them, so too is entirely experimental. It is not supported by any rigorous science, and there is no way of knowing if it's even safe, let alone effective.
Ruth Mayer and McHugh responded to the promotion of these standards of care by various activists and, sadly, professional organizations. Reading these various guidelines gives the impression that there is a well-established scientific consensus about the safety and efficacy of the use of puberty-blocking agents for children with gender dysphoria. and that parents of such children should think of it as a prudent and scientifically proven treatment option. But whether blocking puberty is the best way to treat gender dysphoria in children remains far from settled, and it should be considered not a prudent option with demonstrated effectiveness, but a drastic and experimental measure.
Experimental medical treatments for children must be subject to especially intense scrutiny, since the children cannot provide legal consent to medical treatment of any kind. Parents or guardians must consent for their child to receive the treatment, to say nothing of consenting to become research subject for testing and unproven therapy. In the case of gender dysphoria, however, the safety and efficacy of puberty-suppressing hormones is not well-founded on evidence. Whether puberty-suppressing is safe and effective when used for gender dysphoria remains unclear and unsupported by rigorous scientific evidence.
The sad reality is that prolonged puberty suppression as a treatment for gender dysphoria has, quote, been accepted so rapidly by much of the medical community, apparently without scientific scrutiny, that there is reason to be concerned about the welfare of children who are receiving it, as well as reason to question the veracity of some of the claims made to support its use, such as the assertion that it is physiologically and psychologically reversible, quote unquote.
Puberty blocking isn't reversible. Indeed, the way that activists talk makes it seem like normal human development is an irreversible problem, but interfering with development is cautionary and fully reversible step. But actually, the opposite is true, as Hurst, Meyer, and McHugh explains. This turns the normal language of reversibility on its head. Speaking of the natural process of biological development as an irreversible series of problems that medicine should seek to prevent, while presenting the intervention puberty suppression as benign and reversible.
But doctors have no way of knowing whether these treatments truly are reversible, because very few people have ever sought to have them reversed. There are virtually no published reports, even case studies of adolescents withdrawing from puberty-suppressing drugs and then resuming the normal pubertal development typical for their sex.
Or at least perhaps not in a normal way. After all, as Hurst, Meyer, and McHugh explained, in developmental biology, it makes little sense to describe anything as reversible. Going through a developmental process at age 20 that should take place at age 10 is not the same thing. So talk about these treatments being reversible is inherently misleading.
And yet all of the major activist groups and many professional groups perpetuate this claim. But as Ruth, Meyer, and McHugh illustrate, quote, if a child does not develop certain characteristics at age 12 because of a medical intervention, then his or her developing those characteristics at age 18 is not a reversal, since the sequence of development has already been disrupted.
In essence, doctors are engaging in a giant experiment of minors by blocking their maturation, and they're doing this without even coming close to the ethical standards demanded on other areas of medicine. So while the claim, we've got 90 seconds on the live feed. We're going to keep going to the recording of an additional 15 minutes, so please bear with us. So while the claim that the initial treatments are reversible may seem less than drastic, this claim is not well supported by evidence.
As Ruth, Meyer, and McHugh explained, it remains unknown whether or not ordinary sex-typical puberty will resume following the suppression of puberty in patients with gender dysphoria. Puberty blocking may have long-term health consequences. There are also long-term health risks associated with the use of puberty blockers for gender dysphoria, though no one really knows all of the potential consequences since this use has not been rigorously studied.
Nevertheless, as the doctors explained, some of the known effects of puberty suppression of physiologically normal children are what you would expect from alterations made to the critical stage of human development.
In both boys and girls, it negatively impacts their growth rates in terms of height. Children placed on puberty blockers also have an increased risk of low bone mineral density. Ruth notes that other potential adverse effects, including disfiguring acne, high blood pressure, weight gain, abnormal glucose tolerance, breast cancer, liver disease, thrombosis, and cardiovascular disease.
And all right, some of these kids end up, going on hormones, and the MTF candidates that are developing breasts are going to develop cancerous breasts. It's crazy.
Yeah, and they will not be able to develop mentally
at all
as well.
And they will not be able to develop their genitalia, which will create major problems in the long run. And, of course, all these children persist in their transgender identity and take puberty blockers and cross-sex hormones will be infertile.
The sad thing is that, we were watching a little snippet of Jazz's show, and when the doctor said that they didn't really have enough penile tissue to work with, it was directly the cause of these puberty blockers, which have suppressed this young male-bodied individual from even being a candidate for what they want to have as their sexual reassignment surgery, and it's ironic that something that supposedly is supposed to be beneficial for their development as this person that they want to be is detrimental to their development in that other, world.
Right, and what if they're type of the transsexual who don't want to get bottom surgery, so now they don't even have a working genitalia.
Right.
So now they're a eunuch, literally, without any capability of having orgasm, having feelings, of being able to bring kids to the world,
But it's like their sex drive is diminished to the point where they're not even allowed to be sexual beings. I mean, they were talking about something, and the dad mentioned something about orgasm or something, and Jazz was like, you're
not
talking to the wall because they don't know what that feeling is about.
So puberty suppression hormones prevent the development of secondary sex characteristics, arrest bone growth, decrease bone accretion, prevent full organization of maturation of the brain, and inhibit fertility. Cross-gender hormones increase a child's risk for coronary disease and sterility. Oral estrogen, which is administered to gender dysphoric boys, may cause thrombosis, cardiovascular disease, weight gain, hypertriglyceridemia, elevated blood pressure, decreased glucose tolerance, gallbladder disease, prolactinoma, and breast cancer. Similarly, testosterone administered to gender dysphoric girls may negatively affect their cholesterol, increase their homocysteine level, a risk factor of heart disease, cause hypotoxicity and polycythemia, an excess of red blood cell, which I had when I was on testosterone, increase their risk of sleep apnea, cause insulin resistance, and have unknown effects on breast, endometrial, and ovarian tissue. Finally, girls may legally obtain a mastectomy at 16, which carries with it its own unique set of future problems, especially because it's irreversible.
Other questions that I wanted to ask you was, when they do end up constructing a phallus for a female-bodied person to have, then that basically kind of covers up the vagina, right?
Yeah, they close it up.
So there's literally still a gap inside.
Yeah.
So how does that...
It festers.
How is that allowed to be...
That is very unsafe. It festers. It's a cavity that could create infection in there, yeast and all sorts of stuff.
I mean, could there be a place where polyps would grow?
Oh, yeah, all sorts of stuff. All sorts of
UID infections would develop, but they'd have no way to get out?
Yeah, and that's what happens also with MTFs who have their vaginectomy, that there's cross-contamination between the rectum and the newfound vagina, and there's problems, as we've seen with people that we actually know.
Not surprisingly, given how little we know, the use of drugs for puberty suppression for children with gender dysphoria is not FDA approved, but the off-label prescription of such drugs is legal.
The bottom line for us, Meyer and McHugh, is that we frequently hear from neuroscientists that adolescent brain is too immature to make readily rational decisions, but we are supposed to expect emotionally troubled adolescents to make decisions about their gender identity and about serious medical treatments at the age of 12 or younger.
It's really, rejecting human nature has real human cause.
Yeah. It's crazy stuff. But, when the lawsuits come in, when these parents that are vulnerable because they think they're doing right by their kids, and I feel a lot of empathy for these parents because Some of them are just confused. They're scared. They don't want, their child to commit suicide because that's been the line of, of choice. And they go ahead and do this thinking they've done great things for their children. And as we learned, that 12-year-old who transitioned 2 years later decided to go back to being a boy, and he was all mad, it's like, why did you allow this to happen? You're the adult.
Right.
You know?
Kids, they are very impressionable, and teens are very much, caught up in peer pressure and stuff so much of the time. And, being a teen is like being half child, half adult, but you're not quite either, so you're kind of wandering. It's like the wandering years where you're trying to find yourself, where you're trying to make sense of realities, where you think that, what you know is better than what your parents know because you think that your parents don't know anything. And then once you hit 25 and older, you get back to this reality and you go, wait a minute, Mom and Dad, I'm so sorry. You guys were right. I mean, what was I thinking? And
then it's too late. Because,
and that's just common development. That's just common. We're not even talking about gender issues. We're just talking about how kids are going to think that their mom and dad are dumb, during their high school years. And then in college, they're going to kind of get a sense of a little bit of a rude awakening as to, maybe mom and dad aren't that far off after all,
People really have to think this through, and as do the adults, because a lot of this stuff that they do, even though they're adults, may later come back and haunt them and bite them in the ass, as I like to say.
Well, let's just come down to the point here that any kind of drug is not good to put in the human body, period. Let's not even, we can go beyond gender with this. We can say, if it's not natural, it doesn't belong in your body, so.
Yeah, I think we should do another one of these shows on our TRTV, and really, because that was a very good article. It's a recent article, and I'd like to get parents involved, and I'm not even sure if this is actually recording the rest of this thing, but I'd like to get parents involved, and parents that really, might have second thoughts of what's happening and seeing their kids haven't really blossomed the way that the so-called trans advocates say. Anyway, guys, thank you so much for tuning in. We'll be back on Friday and with another great show topic. I haven't put it together yet, but I will post it on our blog and our Facebook. So just take a chill pill. Take it one day at a time. Don't sweat the small stuff, and love yourselves,
That's the most important
thing. Because, we love you too, right?
We do.
Yeah, so you guys have a great night, and see you on Friday.
Panera now delivers, so you can order good, clean food right to your office, or door, or porch, or backyard, or front yard, or apartment, or dorm, or castle, or shop, or worksite, or wherever. For lunch, dinner, and everywhere in between. Click the banner to order or visit PaneraBread.com. Participating locations only. Panera. Food as it should be. Panera now delivers, so you can order good, clean food right to your office, or door, or porch, or backyard, or front yard, or apartment, or dorm, or castle, or shop, or worksite, or wherever. For lunch, dinner, and everywhere in between. Click the banner to order or visit PaneraBread.com. Participating locations only. Panera. Food as it should be.